Hey, Dr. Drew here with Inspire Cosmetic Surgery. This is another episode of Inspire Insights, a program where we try to educate patients on what to expect from their surgical procedures. So today we're going to actually talk about transgender top surgery, or FTM, female to male transgender top surgery. I prefer to call it by its technical term, which is a simple double mastectomy with a free nipple graft, or certain other options include a keyhole procedure, a buttonhole procedure, or an inverted T procedure. And I can go through what those different things mean. It's very important to choose your surgeon, choose your facility very wisely. You want to make sure that you have a surgeon that is very experienced. Myself, I've been doing this procedure for the last 16 years of practice. And it's extremely important to look for a surgeon where you're going to get the results and the treatment that you expect. It's important to look at the pictures out there online, decide who has the results that you're looking for. So I'm going to go through these procedures and I'm going to show you what the differences are, because there's a lot of confusion out there. And I'm going to show you how I like to do things and how my patients seem to be the most satisfied when these procedures are performed with the Inspire techniques. So let's get started. This is a typical female chest. The red that you see here are the pectoralis muscles. Those are the muscles that flex the chest and that give a masculine shaped chest when there is not as much breast tissue on there, such as in a male chest. So there are different techniques for doing typical double incision surgery or a simple mastectomy with free nipple graft. So we're going to go through those techniques and then I'll address the other techniques afterwards. So generally when we start looking at somebody and evaluating them for this procedure, we mark the midline. And the midline is very important actually in this procedure, because a lot of surgeons will actually connect their incision in the middle here. It's much easier. It makes this surgery much more technically simple to connect this incision in the middle. That means that there's essentially one straight scar all the way across the chest from side to side. I particularly do not like connecting that incision, even though the surgery is quicker and much easier to do that way. And these are the reasons. So when you have breast tissue, the breast tissue tends to come medially towards the midline. And when that breast tissue meets toward the center, it leaves us a dilemma on how to deal with this excess tissue in the middle. A lot of people deal with that by simply connecting these incisions across here, and that way that tissue can just be pulled down and tightened. The problem is now you have a very unnatural looking chest with a connected incision down the center. That's why I try at all costs to avoid this incision down the midline. And I like to actually make sure the incisions don't cross the midline, and if anything, go up or simply go out, depending on the size of the breast that we're starting with, to not connect that in the midline. With these scars, the chest looks much more masculine rather than connecting that scar in the center. So when I make these incisions, they're made in the Inspire incision technique of keeping these incisions vertical and lateral, so that incision stays as wide as possible and the incision comes right to the area of the inframammary fold. And that incision continues out laterally or to the side of the chest as far as it needs to try to minimize or decrease the amount of fatty tissue or folds out laterally. With the Inspire sculpting technique, we actually take this tissue down with liposculpture, as well as some of the folds that are in the pre-axillary area here, which also give a less male-looking chest when there's too much tissue in this region. So we take this down as well as this, based on the patient's anatomy and their level of need. This incision, again, comes as far laterally to minimize dog ears or bulges of tissue out to the sides that also look unnatural if not handled properly. So this incision just around the area or above the inframammary fold is planned strategically to leave tension off of the closure. The more tension on that closure, the wider the scar gets and the more unsightly the scar is when it's completely healed. So we try to do this in a technique by advancing tissue with quilting sutures underneath to take tension off of the closure and to make sure that this has a multiple layer closure that takes tension off of the wound and gives a better final scar outcome. I can't stress how important this is technique-wise to make a multi-layer closure, which some people avoid because it's quicker to not put in those multiple layers of suture and use the finest quality of suture materials in order to make sure the tension is taken off of the wound to get a better scar result. When we finally put this together, again, I try to design this in a more male shape so the chest has a bit of a squareness to it as opposed to just a roundness to it. That way, we get a more masculine appearing chest. Once the incision is made and the nipple graft is harvested, the nipple graft is harvested from the area of the areola, and it's made in a male size, usually about 2 centimeters in width or the size of a nickel. So that's about 3/4 of an inch, and the rest of this tissue is discarded along with the mastectomy specimen or the breast specimen. So we harvest that 2-inch areola in this area from both sides, and we save that for the end of the case. Once we lift up this tissue, remove all of the tissue and leave enough breast flap or skin flap to close this wound under the least amount of tension, then we can create a flat chest, and then we put the areola back in place where it's grafted. So the area that the nipple is supposed to be is at the junction of the inferior border of the pectoralis muscle and the lateral border of the pectoralis muscle. So the free nipple graft should end up somewhere in this area. When we do that free nipple graft, we actually put it on in a little bit of a diagonal. So it's done a little bit like this as opposed to a completely round circle. That way, with the tension that is on any wound, it actually stretches out into a more circular nipple areolar reconstruction. So that kind of goes through the technique for a double incision surgery. Before we completely close in layers, we also put a drain in place that drains excess fluid out from the side of the wound. That drain is connected to a bulb, which collects that material that's suctioned out. That helps to keep the nipple graft intact. It keeps the tissue from floating off of the closure, and overall a better contoured and nicer result. I don't pull those drains by a specific day. It completely depends on how much output there is. There are people who take off those drains at a very specific time every single time. That has to be tailored to the patient. The free nipple graft, however, usually needs to be bolstered down or dressing sewn over this graft for a period of 5 days. And after 5 days, that can come off, and then regular dressing changes can be done to take care of the wound, as well as dressing changes on the regular rest of the wound, which is usually simply triple antibiotic ointment and a light layer of gauze just to protect that. We fit the patient with a compression garment afterwards, also to try to keep the tissue down and adhering to the chest wall.